So I personally think we very much underdiagnosed disc injuries.
Talk to me about disc herniations. Is that a very common challenge pain that people see very specifically in spine disc herniations? Based further to what you just mentioned about whether surgery is needed or not.
Part of our everyday as a chiropractor, it's part of our so it's everyday exposure. So I personally think we very much underdiagnosed disc injuries, and we base it often on whether there's neurological involvement or not. So is the nerve being compromised? Is the nerve being irritated? Is the nerve being damaged? That's when all of a sudden we get a little bit heated about disc injuries. But I think by and large, most of what we see, it probably has a disc inolux involved in it. It never gets diagnosed as a disc injury. Okay, it's often clears up and is treated by manipulating the joints and getting the function back into that area of the spine, restoring normal function, getting the nerve to fire properly, getting the muscles to relax, getting rid of inflammation, and getting normal mechanical function back into that spine. 99% of the time, we're back up and running. Where it starts to get a little bit more shock.
So you're basically saying with disc herniations, being a chiro is the first place you go.
That's the area we specialize in.
Okay, that's what I wanted to hear.
So where it then gets a little bit more, where you might want to have a little debate, is on the extent of the disc damage. Okay, so where you get a slight disc bulge, you may well have some fairly significant symptoms, but most of the time, with the appropriate treatment, that will settle down in and you'll be fine. Most disc injuries, given the time, given the right environment to heal, settle down, and you do not need surgery. Where surgery starts to come into the game is on the extent of that disc herniation of disc. Now, if that disc bulge starts protruding further and starts to compromise the nerve to the point that the nerve could become damaged, now let's start having a conversation about whether you need surgical intervention.